Hey there, how are you two doing today?
Good, thank you.
Well,
Glad to hear it. So, if you guys could just introduce yourself real quick for us, give us your name, your title, a short bio about yourself, your credentials, and then one of you could please state the name of the article you guys wrote.
Okay, well, I am Dr. Eileen Fry Bowers. I am the Dean and a professor at the School of Nursing and Health Professions at the University of San Francisco in California. I am a nurse, a pediatric nurse practitioner and clinical nurse specialist by education and training. I'm also an attorney, and I've worked for several decades in both acute and community-based settings, focusing on the care of children and families.
hi, I'm Cynda Rushton. I am a professor as well of nursing and bioethics at Johns Hopkins University in the School of Nursing and the Berman Institute of Bioethics. And like Eileen, I started my career in pediatrics as well and have had many, many different roles in nursing, including being the co-chair of the Johns Hopkins Ethics Consultation Service for a few decades now. So we are delighted to be able to share this article on reimagining nursing social contract with the public.
Fantastic. Well, it was nice to get to know you guys a little bit. What made you really want to write this article that you're talking about today?
Well, this article actually came out of many conversations that Eileen and I had had during COVID about our concerns about what was happening in clinical practice for nurses at the front lines in particular, and how there seemed to be a widening gap with the patients that they were serving. We were seeing very alarming instances of violence toward nurses. We saw instances where the public was really challenging nursing's commitment during the pandemic in a way that left us really concerned about how this relationship with the public was being undermined. And we felt like it was really important for us to step back and reflect on where we've come, how our relationship with the public has been defined, and what might be needed to heal that divide and actually recalibrate how nurses and the public work together to create health for everyone.
I think that we were also stimulated to write this article because we kept asking the question, what would happen if there were no more nurses? And that really sort of set us to a place where we really wanted to think about what are some of the things that potentially could lead. We hear about the nursing shortage, and what are things that were happening in society that might exacerbate that further. These challenges existed before the pandemic, but then of course the pandemic just amplified things, and we really started to ask the question, what would happen? And so as Cynda said, this gave us an opportunity to sit back and reflect and look at the contribution that nurses make to the development of health in society, to the delivery of healthcare in society, and again, reimagine the relationship between the public and nursing, the profession as well as individual nurses.
Well, that's fantastic, and it sounds like such an important topic that you two are touching on. What would be a reason why nurses should read this article? What would make you say as a nurse, oh, this is why I should read this article?
Well, excuse me. I think one of the reasons that nurses might be interested in this article in particular is I think that it helps to explain perhaps some of the distress that they've been experiencing, because what I know about nurses is the main fuel for their work is their patients. And when we are able to actually serve in the way that we are trained to do, and that is received in the spirit in which we offer it, it gives nurses the fuel to keep coming back. And I think for many nurses, this divide has really left them feeling abandoned in a way, that the people that they have been trained and committed to have maybe turned against them, and in ways that are causing them to wonder if they still belong in this profession. So I hope it'll provide them with some context and maybe some new ways to think about this issue.
Yeah, I think it gives them an opportunity to reflect on their profession, reflect again why they do what they do. Think about the actions that they can take, the words that they can use to describe how they're feeling, to describe what they do, to teach others what they do, to communicate to the public what they do. I hope that we've given them a language that allows them to discuss this on a level that they find empowering, and provides them with some action-oriented steps that they can take to alleviate some of those feelings of distress, to really take the power to help move our profession forward in its relationship with the public.
That's amazing, and with such a wide variety in this topic that you're speaking about, if you could narrow down 2 to 3 things that you'd like nurses to specifically take away from this article, what do you think those things would be?
Well, the first thing is that the work that nurses do really does matter. And part of shifting and recalibrating our relationship to the public is to actually claim the contributions that we make every single day in outcomes for the people that we serve. And I think that, as Eileen pointed out, having some language and some real intention around how do we talk about what we do? How do we want to describe our work? What do we want the public to know and understand about what it means to be a nurse today? And I think that we've given some very specific ways that nurses can do that. Number one, how they speak about themselves. But also we've challenged leaders, the policymakers, and the public to be part of this solution, to join with nurses and be allies with them, that we're not alone, and that truthfully the healthcare system is unsustainable without a healthy workforce. And we want nurses to know how much their competence and their compassion matters to every single person they touch.
Yeah. The work matters, and the language we use to describe it matters. I think, we really need to move beyond a narrative that talks about nursing as the most trusted profession. We really need to help people understand why that is. We really need nurses to embrace language around explaining why that is. What the essence of nursing is. Nursing is essential in society. Nursing is a public good, and we need our profession, ourselves as individual nurses, as well as our profession at large, to really be able to communicate that, to be able to ensure the stability of a workforce, to be able to ensure that there will be nurses available to care.
Amazing. Well, thank you both for sitting down and talking to us a little bit about this today. We really appreciate it. And thank you again for writing the article for us.
Thank
Our
you.
pleasure.